Welcome to this presentation on how to create an account in healthcare.gov and how to review your information. This program is the Affordable Care Act and is intended to help you financially so you can afford the monthly premium for health coverage. Now, as I said before, the new administration has made many changes to this program, and unfortunately, they are now checking each customer account to ensure that the information is correct. Now that most of you have filed your taxes, they will take that information from your taxes and check against the information in your application to ensure that you gave the correct information. If the information does not match, you may owe taxes to the IRS. So we must make sure that the information it is as correct as possible. Okay, so now you're going to access the information directly in the healthcare.gov database where all your information is there. And for that, you must have an account, which is why we're here. Now, this might be a long presentation, so please make time to sit down and finish it all. I recommend that you watch this presentation first. Then you can go ahead and create your account and start working on reviewing your information. If at any time you're having problems or you prefer to meet with me to complete all this, please contact me by text so we can set an appointment to get this done. Just to be clear, this process is not optional. The administration is canceling health plans left and right. It is my duty to make sure you are not one of them. This is free service for you. As a disclosure, the insurance company pays me a commission to be your agent, so I am held responsible for their election of duty if I do not do everything possible to help you. Okay, we're going to move on to the next slide here. So this is what, when you're ready to do the review, I don't want you to make any changes. You are just there to make sure that information there is correct. So if you see anything that needs to be changed, I need you to note it, and then you need to notify me of those changes that you noted and that you want to make. What I'll do is I'll contact you to authorize those changes. See, there is a process to all this, which requires your signature or approval. When you're ready to start the process, you need to have a good estimate of what will be your annual income for 2026. So make sure you have that ready. You will also need an email address. So if you don't have one, you need to make one because healthcare.gov will send you a code to verify your address. So this is very important. Okay, let's move on to the next slide. Okay, so let's go ahead and get started here. First thing you're going to do is you're going to go to healthcare.gov on your computer. I suggest a computer because with the phone, it's going to be a little bit harder. But if you're good doing using the phone to do anything, then that is also fine. On the right hand side, you're going to see the word login. So go ahead and click on that. You're going to come to the login page. If you already have an account, just go ahead and log in and you'll follow the process. If you don't, you have to create your account. So please click on create account. Okay, so the first thing when you get to this page, it's going to ask you for your state. So make sure you pick your state. Then it's going to ask you for your first, last name, email address, and then you're going to give a password. They want 8 to 20 characters, and you must have an uppercase or a lowercase letter. And you also had to have one or more numbers. And that's all you need. However, if you do want to add one of those special characters, you can't use any of these. You have to use a different one. But you don't need to add a character. You just need um, uppercase, lowercase letters, or numbers. And the next thing you have to do is the security questions. Nowadays, everybody uses that, especially government programs. So you have to click on that little thing here. You're gonna select a question, give an answer. So you need three security questions. Please make sure that you write this down somewhere. Okay, so you don't forget, because then you'll have to call directly to the marketplace, and that takes a long time if you forgot your password or if you forgot your security question. Once you do all this stuff, go ahead and click on create account, and they're going to send you a code to your email address. So you need to go there into your email address, and you're going to get an email from the marketplace. It's going to look like this: from Health Insurance Marketplace. Okay, and then it's going to say verify my email address. So you're going to click on it, and that is all is needed to verify your email address. Then you're going to click and log in. Okay, so far everything is good. Now we're going to go ahead and enter the email address and the password. Again, it's so important here that you got to make sure that you write down your email and your password, because it's going to be very hard uh, to recover that information here. So please make sure you do that. You're in. This is the first thing you're going to see. If you want to do it now, you can go ahead. The first time, you can go ahead and set up a authenticator code, where they're going to send you a text message to get in there. It's like a protection. Or you can just skip it. You can set it up later. Okay, so it's up to you if you want, whichever you want to do. We do suggest always to protect your account. Now it's just too much information on the internet, and too many people trying to hack accounts. All right, so this is going to be your next screen that you're going to get to. All right, and what you want to do is you want to click where it says manage account settings. Okay, when you click that, it's going to come to account settings, and you will see here identity wasn't verified, verify now. Excuse me. You need to click on verify now, and then it's take you to this page. Let's verify your identity, and they will ask you for first name, last name, date of birth, and social security. Make sure you enter all that information, please. If you have any issues, um, which you shouldn't, but if you do, let me know, and we can go ahead and work work it together. But it's very simple. And again, use your full name as it appears on your legal document, like a driver license. So make sure that that happens. They're going to ask for your street address and your phone number. You can choose mobile home. You don't have to. That's optional. And then once you fill all that out, just click I agree, and then click continue. Okay? And then if everything goes good, it's going to say your identity has been verified. Excellent. All right, everything is nice. So click continue. And then now it's going to ask you for your application ID. And this is what I sent you on the text. You're going to put that application ID number. The coverage year is going to be 2026. And then you're going to select your state. Everything should work when you click find application. When you click that, everything should work. Now, if it doesn't work, that means that some information does not match with the information they already have. It could be a middle initial, maybe your county wasn't there. If you have any issues and you can't do it, then you need to let me know, and then I will go ahead and work with you to make sure. But hopefully everything is fine. And as soon as you click find application, it's going to tell you everything is great. Okay. Um, Whenever you need to go to the home page on the right, you're always going to have this on the right hand side, a menu with your name on there, and you just got to click account home. So whenever you lost, just go to account home to start everything. Okay. Just remember that. All right. So once you're in, there is going to be your application number. You're in. And this is what you're gonna see over here. And the left hand side, you have the different menu options here for the menu. We're gonna go through there real quick, but the main one we're gonna be working is report a life change. We'll tell you why. Okay, so if you click on my plans and programs, it's gonna tell you what plan you're in. It's gonna tell you what the premium is, which means is what the plan normally costs outside on the market. This premium tax credit, this is how much the government is going to go ahead and give you as financial assistance. It's called premium tax credit that you will use against the base premium. So in this case, this person here receives six is going to receive $612 of financial assistance, and all he's got to pay a month now is $14.74 a month. Big difference, right? 626, but after the financial assistance or premium tax credit, it's the same thing. Um, this is what the person's got to pay. So this tells you the name of the plan, it tells you the company and their phone number. All right. The next thing here is my plan profile. And again, application details. This my plan profile eligibility is really some information. You can look at it later. But application details, it just tells you that the application is complete. And if you click and view eligibility result, it's going to give you a document that gives you more information regarding that. Also, sometimes the government requires that you submit documents. If that is true here under application details on the bottom, you're going to see what documents they want you to send. And they are going to give you a deadline to do that. My job is to make sure that give that information to you. All right. This gentleman here did have some documentations confirming incarceration status that he went ahead and uploaded it. Normally, there will be a little thing here that you can click to upload the documents. Since he already uploaded it, then it doesn't show up. So if that happens, this is where you go. But I will be there to assist you with that. Okay, let's see what else we went to. Eligibility results. That tells you that you're eligible to buy a marketplace plan. And again, you can click on the view eligibility, and it's going to give you that form I told you about that. So you can, it's going to download it to your computer. It even tells you here how much credit they gave you or financial assistance, $612. All right, and the next one here is communications. If your number changed or your email changed, you can go here to communications and change it. You don't really have to go into the whole application, which is what we're going to be doing, to just make those specific changes. You can edit right here and put it here. But that's pretty much the only quick change that you can make. Otherwise, you'll have to go into the report the life change to access the application. That could be long. Let's see what else. And no, there's one thing that we didn't go through here, but tax forms. This is where you're going to click here to get your 1095A that you're going to need to do your taxes. So for 2025, pretty much most of you received it by mail, right? But if you don't receive it, some of you came to me and I was able to get it for you. However, now that you have access to this, you can actually come yourself and click on tax forms and you will be able to go ahead and do that. Now, I went back a little bit here, so we need to go back here. Okay, now we're going to click here to the left where it says report a life change. And this is where what is going to give you the entry to get and access the application here. And you're going to click this one that says report a change in my household income size or other information. And we're going to use this one here, not the first one, because this is just for to move to a new state. We're going to use this one here. Click here on the little circle or little square, whatever it is, and you're going to click update application. And that's going to give us access to the application. This is the first thing you're going to see. You can read it. There's sections here where you have to click where it says I agree and I understand. Once you do that, you click continue. It's going to take you to this section. This kind of explains the different sections of the application, and we're going to go one at a time. Yeah, you're going to continue to application, click on that, and this is just tells you about the application setup. Uh, we're going to click continue, and now we're going to verify the information here. So this is where you need to start verifying your information. Your first name. So we're going to go quickly to this because it's really self-explanatory. Here's your name, date of birth, whether you're male or female. Click continue. Your street address. Click continue. This is, of course, every now and then this comes up where you have the postal USS Postal Service, and it tells you to choose the suggested address. I always choose suggested address because that is more accurate. It has the five zip code plus the last four. So I would always pick this one here if you want to. All right, so let's continue. Your email address, your phone number. You can click this if you want to. You don't have to. I always click mobile. If you want to add a second number, you can add a second number. All right, let's continue. You say prefer language, English, Spanish, or whatever. Continue. Um, this is where there's a little selections here. Do you want the marketplace to send you updates? You can click to set it to your mail or the email. Um, it is optional, I believe. So continue. Okay, this here is where you'll see my information as your agent. It should have my information. This is my information and this is my number. If you see something different that is not this, the only change, this will be the only change that I need you to do here. I need you to click remove. That's the only change that I want you to do. Remember, I told you that I don't want you to make any changes. All you're doing is reviewing your information and noting to see if there's any changes. But in this case, it's very important here that you click remove because if there's another agent there, it should not be. It should not be. It should be my information only. And then you will let me know. Okay, and then we'll have to figure out, I'll have to find out why is this person here and not myself. And then that will be something else we'll have to work on. Okay, thank you very much for that. I really appreciate it. And let's move on. Again, you're gonna see this again. You don't have to do anything because you're not gonna add anybody in here. So you can skip this one here after you click remove if you do. Okay. All right. Now the next session is who needs health coverage. Now this person I'm using this as a for the presentation is single, so only his name is here that needs coverage. See, so this is the only person that will need health insurance coverage. But we do have people that are married or have dependents. So if your spouse needs coverage, it should be here also listed. But if she does not need cover, or he does not need coverage, or your spouse doesn't need coverage, then it will not be listed here. Okay, this section is only for the people that need health coverage through the marketplace. Okay, so if there's no changes, then you can continue. All right, this is Medicare. If you're on Medicare or Medicaid, um, for most of you, all of you should be no. Right now, you're reviewing the information, so 90% of these it's already filled in the information here, but sometimes the marketplace, I don't know why, um, it will ask you to redo it again. So you're going to see some information here that it requires you to click on it. Okay, so everybody should be no unless you are now 65. Then you need to let me know. Okay, um, again. um, any changes that you make here is going to go ahead and modify your financial assistance. So um, this will affect your financial assistance. So if you are in Medicare or Medicaid, please don't make any changes here. Just put no for now because that's what it was in the beginning. All of you guys, all this information is no because as you know, you cannot have a Medicare program, which is another federal program for health insurance for those that are over 65, or state Medicaid, which is a Medicaid program for health insurance through the state. You can't have this and be enrolled in the marketplace program. So, if it is, so hopefully all of you will be no. Okay, but again, if you are, then just put no, and then you need to let me know, and then we'll have to call the marketplace together to cancel this insurance. Okay, and the next session is personnel and household information here. The first thing is your status, single or married. So you're just gonna click on that, click continue. These are questions about taxes. As you know, you must file taxes, so it has to be yes. Will you file a taxes? This is whether you have dependents. It's already been filled in, yes or no. If you have dependents, um, here should be everybody should be no here. No one else can claim you as a dependent since you are the principal person here. If anything changes again, I need to let me know. All right. Then, if you're taking care of someone, you click yes. If not, you're going to click no. Uh, this is for American Indian. So, or if you incarcerated, if it doesn't apply, just click none. Okay, just make sure you click the appropriate check mark or checkbox. I continue. This is all optional. This is about demographics. The government wants to get this information, kind of compile data, basically. It is optional, but if you want to go ahead and click your nationality, you can go ahead and do that. Okay, this is your social. Please verify, normally you're only going to see the last four. Okay, so everything is already filled in. So if this is correct, just put yes here and then click continue. Please do not put no. Okay, yes, everything should match. Okay, all right, this is a citizen. Yes, if you're not a citizen or you're an alien or permanent limited, then that already should already be no. Okay, so this information should already been filled in. Let's click continue. If you're disabled, most of you will have no here. It should already be no. Now, why is this important? Again, if you have a disability such that it needs to be noted here, um, what the government is assuming here is that you should be receiving assistance from the state and you should be on Medicaid. So if you put yes, the government is going to go ahead and send this information to the state. That may affect your financial assistance. So please make sure that if this changes and you are completely disabled, you need to let me know. Okay. Same thing again, Medicaid. If you're on Medicaid, you should not be on Medicaid if you're receiving marketplace financial assistance. So this should be no for everybody. If it is, you need to let me know. Again, another Medicaid here for your kids. Excuse me. All right, now we're gonna go to the income. This is very super important here. Again, a lot of people that did their taxes for 2025, I got a lot of complaints saying that they owe money to the IRS, and this is the reason why. Is because throughout the year things change. They did not update the marketplace, and that's why we're doing this now. This tells you what your income is on the application currently. You need to verify that. So by now, if you have a job, you know based on your stub, you know how much you're receiving a month. Multiply dice times 12. Okay, so your monthly income should be this. If it's not, you need to let me know so we can fix this because the marketplace takes this information plus your filing status plus your zip code to come up with the premium tax credit or the financial assistance towards your monthly premium for your health coverage. So, if this information is wrong, your premium could be lower or higher, and we need to know so that we can make the changes. Otherwise, again, at the end of the year when you do your taxes, that is when the IRS will say, okay, you're going to owe us money. So please, if this number is not correct, you need to let us know. Let me know so we can make the changes. And this is the main reason why people owe taxes. And this tells you what the year is, the total amount based on that monthly information you put in, right? This times 12 is this. So please, if this is not correct, we need to go ahead now that you have a job. I mean, know that it is the month of May. You should have a good estimate of what your income is going to be for the whole year. Okay, very important. All right, and then we got current coverage and life changes. Again, this is for people that this all these next sections is for people that um, want to go ahead and change their plans. You cannot make your plans are not going to change. You're not able to enroll or make any changes to your health plan unless you have some life changes. So the marketplace wants to know if you have any changes. So for the first question is, are you currently enrolled? Of course you are. So you're going to put yes, and then you're going to have marketplace coverage. That's a simple one. So you click that, you click this, and you move on, and that's it. This health reimbursement arrangement has to do with your employer. If you have a job when you have an employer, then hopefully you will know. Now, most people do not know, so they have to go and find out from the employer. What you'll do is you go to your employer, whether it's HR, and find out if they offer health reimbursement agents arrangements. This is very important because now the administration is checking to see if you have a job, and if you have a job with an employer, they're going to check to see if the employer offers this type of arrangement. If they do, they're going to send you a document through the mail asking for you to review and answer some questions. You need to let me know so I can help you with this. This is a big change that is affecting a lot of them. Same thing with so if you know that is not, then you're good to go. It should be no, no. In any case, if you're not sure, just put no, no, and then go find out. And if it happens that your job doesn't do it, then you don't have to worry about it. But if you do find out that they do offer this, you need to let me know so we can work. But for now, you're just reviewing your information and you're going to click no because that is what it was in the beginning. Same thing with job-based health coverage. If you know, you need to find out, does your job offer insurance? If they offer insurance, you need to let us know. You need to let us know because what the rules are, if that they are now enforcing, strictly enforcing with this new administration. Remember that is the goal of this new administration is to try to lower the cost of this program by targeting folks so they can get them off the health coverage. Simple as that, guys. So one thing they're doing here is, hey, last year they found out that a lot of people that were receiving financial assistance, they actually their job actually offer health insurance. So unfortunately, you can't have both. There is an exception, and that's the reason why you need to let me know before the agency, the marketplace, finds out, and then at the end of the year, you're gonna get a big surprise. So the question here, at this point, all of you, is no. That's the reason why you have a marketplace, because this is no. So make sure that you click no, and then you need to go back to your job and ask him, hey, do you offer job insurance? If they say no, that's not a problem. You don't need to let me know. But if they do, you need to let me know so we can work on this. All right, this is special enrollment. This is for folks that want to go ahead and make changes to the plan. You're not allowed to make changes to your plan. You're not allowed to enroll into into health coverage and the ACA unless there is a special enrollment. So for all of you, this all should be no. So no, um, no, no, no. Okay. Now, if you did have life changes, for example, you got married or you moved to another zip code or you had an additional dependent that you're going to be claiming this year, or you're losing a dependent that you're not going to claim this year, we can apply for a special enrollment, and we can give you to see if you want to change your plans to a better premium. So that option is available. Just let me know. Okay, those are changes that we need to do anyways on the marketplace. Remember that the information here on your application must match at the end of this year when you're doing your taxes in April 2027 for the year 2026. Whatever information you put on your taxes must match with this application. So please keep that in mind. All right, so now that's it. Then we're going to review this information. If this is the review. So if you scroll all the way down, you're going to see all the information that's there. And then you're going to click continue, and then you're going to come to the agree statements. All of these statements, you're going to click where it says I agree. Okay, so that's what it was, and we're not making any changes. So everything's going to be yes, yes, yes. I agree, I agree, I agree. And then at the end, you're going to click agree, and you're going to go ahead and sign it. Now, for those of you that are going to text me back and said, I reviewed my information and I made no changes, then there's nothing else that we need to do except for some paperwork that we need to send to the marketplace to let them know that this update and review has been completed, and I will send you that information. But I just want you to remember that this here is saying that all the information that you reviewed and there were no changes is true to the best of your knowledge. So you have got to remember that you are you're held to the federal law. Okay, so please read this, sign it, and then submit. And after you do that, that's it. It's gonna come over here. This is saying that you did everything right. You'll see your name here, your eligibility here. Everything should be good. We didn't make any changes, um, except the only changes that you're allowed to make was to remove that the agent that was not my name on there. But besides that, you didn't make any change. So everything is going to stay the same as as of now. um, Here you can see again you have the menu up there to your right always. You can click there and then click home, and it's going to take you to here. And as you can see here, you can verify that your status is complete. That means you have completed the update. And ladies and gentlemen, that's pretty much it. Now I do want to show you this here so you can see um, this is what they're looking for when you're trying to estimate your income. Do you qualify to for the program, financial assistance? And the base. This is what they base it on. If there's only one of you, you can make. This is the minimum you can make. you can make this much, right? Um, all the way to um, right here, 42 for $42,000. They're no longer doing 400. They got rid of it. Okay, but that's why when you are estimating your annual income, um, this is a chart that you use here. So if your income changed and it's less than that, that could be an issue because then it says you don't qualify. So if you don't qualify, then we have to call the marketplace and let them know. Okay, so this is something nice that I want you. So thank you very much. I hope this is helpful. Please, you can go through this video over and over again. When you're doing when you're actually going to start doing it, you can use this as a reference to help you to go page by page. Again, uh, it is important that you let me know when this is completed. If I don't hear from you, I will follow up with you with some text and some phone calls, maybe send you a mail to your home address. This is super important that this gets done. Okay, um, so I will be waiting for your feedback. I want to thank you very much. I know this is a lot of work, but we are in new times, new administration. These are the rules that they have set. We're going to be doing this update every 3 months, um, so that there are no surprises at the end of the year. Thank you and have a great day. Goodbye.